Hello everybody. Today we are going to talk about diseases. Before we begin, if you are new here and you want to become fluent in English faster at all levels, from the basic level and the intermediate level or the advanced level, please subscribe to the channel. Click on the bell so that you'll be notified whenever a new video is posted. And if you enjoy the video, please give it a like. So let's talk about diseases. What causes diseases? Diseases can be caused by a variety of factors. For example, they can be caused by an abnormal or a non-normal, abnormal functioning of cells, which is called a degenerative disease. Or they can be caused by a bad or unhealthy lifestyle. It can be caused by environmental factors or by genetic factors. In other words, hereditary, which means from parents to children, from one generation to another. We also say that it's congenital. It's present at birth. What is the effect of diseases? Well, diseases have a great impact on our lives. They cause death, they cause pain and discomfort. Sometimes they cause disability. And of course, they represent a huge burden not only for the patient, but also for their family and for the society as well. Now, let's talk about communicable and non-communicable diseases. A communicable disease. First of all, it's a disease that is transmitted. It's contagious. It's passed from person to person, either by direct contact or by indirect contact. For example, by air, by food or water. Some examples of communicable diseases are HIV, tuberculosis, measles, cholera, and many others. Non-communicable diseases are also called chronic diseases. They are not contagious, are not passed from person to person. They usually last a long time and they cannot be cured, although they can be controlled. Examples of non-communicable diseases are heart disease, diabetes, certain types of cancer, asthma, and many others. Let's talk about some key terms related to diseases. So the first one is demographics. Demographics is the study of the characteristics of a population. For example, age, race, sex, income level, etc. Demographics is the study of these characteristics. Another term is mortality, which is the number of deaths in a population during a certain period of time. For example, the mortality rate due to COVID was very high in 2020. Then we have morbidity, which is the rate of disease in a population. So basically it is the level of sickness in a population. Then we have incidence, which is the number of new cases of a disease in a population during a certain period of time. And finally, we have prevalence, which is the total number of cases of a disease in a population at a specific time. When a patient visits a doctor because they feel unwell, the doctor will ask them a series of questions about their symptoms and about their medical history in order to make a diagnosis, that is, to identify the nature of the disease. Once the diagnosis has been made, the doctor will give a prognosis, which is a forecast of the likely outcome of the disease. In other words, what is going to happen next? Is it a mild disease, or is it serious? Is it curable, or is it incurable? We talk about the developed world and the developing world. What is the difference? Well, the developed world refers to countries that have a high level of economic development, while the developing world refers to countries with a low level of economic development. However, we do not use these two terms anymore because they are considered offensive, and we try to replace them with other terms such as the global north and the global south. Now let's talk about some medical terms. First of all, we have cardiac, which refers to the heart. So any disease that affects the heart is called a cardiac disease. Then we have infectious, which means caused by or relating to a pathogen, that is a microorganism such as a bacterium or a virus. An infectious disease is a disease that can be transmitted from one person to another. Then we have inflammatory, which means relating to or caused by inflammation. Inflammation is the reaction of the body to harmful stimuli such as pathogens or damaged cells. We also have neoplastic, which means relating to the formation or growth of new tissues, cells, or organs. So basically, it's an abnormal growth. Of course, we are talking about cancer. So any disease that is caused by the abnormal growth of cells is called a neoplastic disease. Then we have perinatal, which means occurring during the time period between conception and the start of the neonatal period. That is the first 28 days of life outside the mother's womb. The tail diseases are diseases that affect the fetus or the newborn baby. Finally, we talk about the rise or the increase of diseases. For example, there has been a steady rise in the number of people who suffer from heart disease. That is an increase, a steady increase. Or we could say there has been a dramatic rise. Dramatic means very, very big. There has been a dramatic rise in the number of cases of diabetes. Well, folks, this is it for today. Thank you for watching this video. I hope you enjoyed it. This is your instructor. I'll see you next time.